Hi, so I know it's been a while since I have uploaded content on my page, and so today I am at work and um, you know, I have never recorded while I'm here just because, you know, I don't really know or think it's appropriate, but um, why not? I'm here by myself and I wouldn't normally do this and I don't plan on making it a habit, so um, if it's something, just an occasional thing, I don't think it's probably going to be a problem, but anyways, so yesterday I was 13 weeks out, so 3 months and a week, and the last few days I've weighed in at 172 pounds, so yay, I'm at exactly 50 pounds down. I feel great. I think I look, as far as looks wise, I'm happy with how I look. Definitely so much more comfortable in my body, and, as far as, you know, just the everyday things of bending down, being an active mom and, all those things. So that's great. But, so I guess that I would say that that's the good news. But the bad news is, I definitely have been struggling with getting the right foods in, and I am supposed to be eating 5 to 6 small meals a day, so every 2 to 3 hours I should be eating, something with, we're told, protein first, then our veggies, fruits, and carbs last. So, whole grains and things like that would be, the last foods that we consume. So, high protein, moderate fat, and low carb. As far as like food choices, I think I do, for the most part, pretty good. I do crave, sweets or, whether it's something like potato chips, so like salty, crunchy things too every now and then. And I will every now and then indulge in those things. And 50 pounds in 3 months, that is a pretty significant weight loss. And I definitely am starting to see like loose skin in my legs. My arms are, not too terribly bad. Like, in clothes, it looks fine. But, if I didn't have this shirt on, like you see that wibble wobble jello looking flab. So, it's a little uncomfortable, and, the loose skin on my legs, I'm hoping that, whether it's through diet or, I think the brand is not Neutrogena, but, Nivea, I think, makes, it's a body wash, and then they also have some lotions that, help to tighten the skin, reduce, whether you have darkness or stretch marks, things like that, like as far as like the tone and color of your skin, it will help with that as well. So I need to look into that. The only thing about that, the reason why I hesitated as far as, going out and getting that stuff is, I just think about like the chemicals that we put in our bodies, or put on our skin. So yeah, so if I could do something, as far as, collagen or, other vitamins, things like that, that might help the elasticity and the bounce back of my skin. Like, obviously, I would want to try and do it as natural as possible. And then I also have read up on like dry brushing and stuff like that, where you use like a stiff brush to brush the skin. So what I think, if I remember right, what that does is increases like the circulation, blood flow to, wherever the area is that you are dry brushing. So, I think those are a couple of natural ways that I can try and help my skin along. So as far as like, I was saying, talking about indulging, I think I'm a little bit more lenient on myself right now than I would be if I didn't have a problem with loose skin. I feel like, losing the weight so incredibly fast, you know, is part of why we end up with such horrible loose skin. So, in the back of my mind, I'm thinking like, oh, it's okay, I've lost this much so far. So, if I slow down the weight loss, then, my skin isn't going to be as terrible. So I don't know. I don't know if that's a bad thing or, just that I'm okay, comfortable with my body and where I'm at and losing more slow going forward. I don't know. So that's where I am as far as like weight loss and food wise. And my other big struggle right now, so I talked about before how I was having real frequent menstrual cycles. Like I would have a period for 5 to 7 days, stop for a week, and then again, start again. So this last month is probably the first month, the month of November and going into December where that's not happening. So hopefully that means that my hormones are leveling out. Now, mind you, I am 42. I just turned 42 in October of this year. Hi, I'm back. That was funny. One of my coworkers was coming back into the office, so I quick switched the phone off. A little awkward talking about not just your weight loss, like I'm fine with sharing with the people that I work with that I've had weight loss surgery, how things have gone, all of that stuff. My coworkers have been absolutely awesome. I love them, as far as, just being understanding, asking how I'm doing. In the beginning of my surgery, when I had weight restrictions and stuff, being helpful, kind, helping me out with whatever I needed, asking how I'm doing. So, but it's like talking about my periods and stuff like that, which it'd be a little awkward just walking into that conversation. So, anyhow, to get back to what I was saying, so yeah, I turned 42 in October, and another thing that I'm just trying to be mindful of is, obviously for us women, I'm sure menopause is probably somewhere in my near future. So, you know, without the weight loss surgery and all the crazy up and down hormones that brings, you know, I have menopause. You know, I don't know if I've started that or not, but, you know, that's going to affect me, my moods, my body, whatever, you know. Yeah, so hormonally, even though, like I said, my periods have seemed to have leveled out, which I'm so grateful for. But emotionally, I feel like even just talking about this and, you know, I'll watch my own videos and watch myself, and it's interesting seeing yourself, listening to yourself, and, you know, being overweight. I realize now, post-surgery, how much I have avoided looking at myself in the mirror, you know, getting dressed, looking at myself, other than, you know, from here up, you know, brush your hair, brush your teeth, wash your face, throw on whatever clothes that fit, because honestly, the clothes that I was wearing when I got to my highest weight, a lot of leggings, a lot of LuLaRoe dresses. So, I mean, those dresses can fit, like the same dress can fit somebody who's probably a size 10. And here I am, like size 18, 20. And granted, don't get me wrong, that dress was stretched to the nines, you know, stretched at the seams. So, but that same dress is going to fit me 50 pounds, you know, 5 sizes down, as a, you know, same dress is still going to fit me because that material is just so stretchy and drapey. So, you know, like I said, I was able to get dressed and not have to look at myself. And now that I've lost all this weight and my old clothes aren't fitting anymore, so I'm forced at this point to go and try to find affordable clothes, and have to look at myself, you know. I put clothes on, and first of all, you know, I went from wearing a size 18, and like a week ago I went clothes shopping, and the pants that are fitting me now were size 12, okay? So it just tells me, you know, like how ill-fitting my clothes, my wardrobe has been last year, or, you know, however long. So, you know, I'm trying to learn this new body, how to dress it, you know, what's gonna look right, what's gonna look good. You know, I'm not saying that like in a vain way. You know, I don't think I'm a vain person. But I mean, you know, like we don't always dress for other people. Like, you know, I don't think there's anything wrong with, you know, dressing for yourself, finding clothes that you like and feeling good about like, hey, I like this shirt, or, you know, I like this new pair of shoes. Like, we're human, we're, you know, creatures of comfort, you know, those are creature comforts. So, yeah, having to like look at myself as a whole, and then you're looking at yourself in this new way, and then you start dissecting and picking apart yourself, just that little short few minute video that I had taken of myself. I'm watching that back and I'm looking at this. Like, I've never had this ever before in my life. I've always really, excuse me, honestly had, like pretty strong jawline. My face is oval, like an oval shape, and watching that video back, like all I could see is the double chin, and then I see this extra loose skin here on the bottom of my chin. And before surgery, I always told myself, and I would like make a joke out of it, telling my friends how someday I would always want a breast lift and a tummy tuck, just with age, honestly, I don't feel like, and from talking to my friends, I don't feel like, as far as our girls, the boobs go,